Happier at Home with Deb Marcello. This morning we're talking about routine health screenings for seniors and getting them at community pharmacies. Deb, good morning. Thanks so much for waking up with us.
Good morning. Happy New Year.
Same to you. Same to you. So talk to us here about these screenings. We know that we saw them start to really drop off at the beginning of the pandemic. Lots of people just stopped going out and doing anything they needed to do. I have to imagine at some point we need to pick up those pieces and start to do the work.
Yes, so often we were not able to get our routine screenings, and our actual routine of staying in our whole own healthcare regimen has dropped off. So this is a great time of the year to start anew and make sure you're getting your healthcare screenings. And now pharmacies are becoming more related to the community, making sure that they are offering opportunities for their general health and wellness to be more accessible. So one of the things that they're doing is general wellness screenings, screenings for blood pressure, cholesterol, blood glucose, but that doesn't stop us from working with our healthcare provider, from making sure that we're continuing to work with them and have our regular healthcare screenings for some very, very important things to keep us healthy.
Now, Deb, how do we find out what pharmacy is a community pharmacy versus, what isn't a community pharmacy, so that we know that they have these screenings and these wellness checks that we can go in and take part in?
So many of them are working with the community now and with the healthcare system. So all you need to do is check with the pharmacy themselves and see what they're offering. So often now, as you know, they've been doing COVID testing, offering immunizations and that sort of thing. But then you do need to work with your healthcare provider to look at things that are are very important, such as osteoporosis. So many people are at risk for osteoporosis, and if they're not working closely with their healthcare provider, they're not going to be able to get that baseline for, say, a DEXA scan. People that are at risk for osteoporosis would be people who have celiac disease, which some people don't know that, or those that are going through menopause. If you have inflammatory bowel disease as well. So making sure that you're working with your healthcare provider for something like that. Also making sure that you keep up on your eye exams. Most people need them every 1 to 2 years, but if you have any kind of congenital deformity within your eye, if you have diabetes, a history of macular degeneration, certainly you need to make sure that you are keeping up on your your eye health more frequently, at least one time a year or as needed as well.
I have to imagine there's a need for skin exams from dermatologists or someone with that sort of medical background for potential skin cancer, no?
Absolutely. And melanoma is one of the worst types of skin cancer. So if you think about the A, B, C, D, E's of skin cancer, of melanoma in particular, you can be screening yourself at least monthly, but definitely need to see a dermatologist for these yearly. So the A would represent asymmetry. B would be looking at the borders if they're irregular. C would be an uneven color, such as blue or black, even white within the mole itself. D is a diameter of greater than 6 millimeters. And E would be if it's evolving or changing. So making sure you're keeping an eye on those different moles that you might have. And if they are changing, make sure you reach out to your doctor right away.
And Deb, we've got about 30 seconds left. Just piece of advice for someone who may be dealing with a parent or a grandparent in one of these situations, and they're not really keen on going to get these checkups. How do we make that happen?
These things drop off so easily from your radar. Just let them know there are different ways of handling these screenings now, even for colorectal cancer. You don't always need to get a colonoscopy now. As a matter of fact, they're recommending you start earlier at the age of 45.
We gotta let you go, Deb. Thank you so much. Local headlines are coming up now.